Welcome back to the Hybrid Therapist podcast with your hosts, Andrew Wild and Andrew Ilieff. Mate, it's been over a year and we're finally recording another episode. How are you?
Mate, I'm good. You?
Very well. It's been a long time coming, and obviously COVID got in the way of things a little bit. And, here we are, nearly over a year later. You've had another baby. I've opened up a new clinic. There's a lot going on.
It's been a big year, hasn't it?
It's been a massive year for a lot of reasons.
Yeah.
What's news on your end?
I think, he who shall not be named, obviously changed the way everything was done for a little bit. Physios went online. We all shut down for a little bit. I think all sensible practices shut down for a little bit. I know you did, we did. And then we've resumed, back up to normal. We've got 2 clinics now, one in Randwick, one in Double Bay. New physios, which is good. New kids, which is busy.
How old's your newborn?
Mate, he's 6 months.
Oh wow, 6 months. I didn't know that.
Yeah. So he was a pre-COVID baby. If I knew COVID was going to hit, I probably wouldn't have had another kid.
He's not a coronial.
No, he's not. He wasn't during. He was before. I'm pretty sure he was Feb.
Yeah.
Maybe or Jan. Anyway, who knows? But, if you were coming into that, you probably wouldn't have planned one around that time. I know there's been a spike of kids, but you wouldn't have actually planned one with what first happened. It was pretty dicey there.
Yeah, true. But I suppose at the same time, a lot of people have enjoyed the time because they're working from home. I have a lot of mates that have had kids in this time, and it's been good because they're working from home so they can spend more time with their newborn and help out their partner if their partner's spending more time at home or whatever. So, yeah, there is always a silver lining.
Mate, there is. Wildy, tell me about your new clinic.
Clinic's going well, mate. I opened up the new shop, when would it be? Probably 6 weeks ago now. So, because I was based in the city, obviously the city became untenable. I couldn't continue on there. Obviously I was inside, my clinic was inside the Marriott Hotel, which was actually a quarantine hotel. So even after, because they actually locked down that gym for, I think it was 4 months in the end. Jeez. So I shifted everything home. I now have a consult room at home. I have a gym on my balcony, which I still have as a second clinic. But yeah, the shit hit the fan. So I ended up just pulling out of the city. And that was probably October, because I tried for a few months after they opened things back up. But look, no one wanted to come and see me because it was a quarantine hotel. It was just unlucky. So anyway, shit happens. You just got to shift. And I pivoted, came back to Neutral Bay. Everything went well. And then I'd been looking for about 3 or 4 months prior to opening up the new clinic at Space. And finally pulled the trigger about 6 weeks ago, and it's absolutely flying, mate. Going really well.
It's good. The suburban effect, I think, has been good for physios. I know we had a 180% growth on our numbers from the previous year because people aren't going into the city anymore. They're staying in suburban areas. You can argue they're exercising more. I don't really believe that's true. I think people are exercising the same amount. They might have changed their exercise.
Agreed. They, might be running more or something like that because gyms closed down for a period of time. Yeah.
Yeah, but I don't think they were doing more in terms of, they weren't just going from not training at all to training. People were just doing different training. And then the whole work from home posture thing and setup issue. And, that was obviously, you've probably seen a few of those.
I think the other thing about it is a lot of people have had the time to go and finally see a physio. They've had their niggling shoulder injury for the last few years and they just haven't had the time, or they didn't want to prioritize it. And then finally they've had the time because they're working from home and they're like, yeah, I'm going to go get that sorted. So yeah, I was exactly the same. Like I actually had a really, really good year, even though I had to shift from, the city back to Neutral Bay. But to be honest, at the end of 2020, I think overall I probably had a better year because of COVID in a way.
Mate, I don't disagree with you. I know it changed the way we did things here, both in the gym and in the clinic. we changed a lot of our policies. We looked at the way we treat things. We looked at the way we programmed and planned, because we never knew when another lockdown was coming.
Yeah, exactly.
So we always set in, contingencies. But, I think like at the end of it, everything got better. I know here we thrived. And well, one thing, I'm still looking for another physio. And I've had an ad out since January looking for another physio.
Can't find one. Need to find a good one.
I actually brought one over from New Zealand.
Really?
Yeah, got a bloke from New Zealand, but he's only part-time. He can only do part-time. But mate, it's bloody hard to find another physio of quality. And I'm going to throw that out there because we've had a shit ton of resumes and a shit ton of interviews, but what I class as quality, haven't been able to find that. I've been few and far between.
This is a good question for you. What are you looking for?
Mate,
because a lot of our listeners are physio grads. They're physio students. What are you looking for in a physio?
And you're 100% there. What do we look for? So let me talk from a private practice sort of perspective. You don't necessarily have to have had private practice experience. So for example, you could have done your intern year at the hospital. I look very favorable on that. I did it myself. I went through that grad year, but I then look at what they did on top of that. So were they doing mentoring with a private practice physio? Were they going and doing casual work with a private practice physio? Were they doing sports work on the side? Were they bettering themselves? Not necessarily in courses, because we all know half the courses out there are shit anyway, Wildy.
Oh, I know that, mate.
Yeah. So, we're looking at people who have at least put an effort into learning that private or being around that private practice side, because, people, and they always ask the question, how do I get experience if you're not going to hire me? But at the same time, how are you reaching out to other private practices to do some shadowing, to find a mentor? So we're always looking at that initiative shown there. I think it had a lot of issue with people coming in, particularly new grads, and just I hate the word, but the arrogance. I can handle this, I can do that, I got no issue treating that. Yeah, I know all this. I'm going, mate, well, I didn't know all that in my first year. I don't even know all that in my fifth year, let alone, as a clinic principal, mate, I don't know all that. So you must be brilliant.
Yeah.
So, and we're looking for someone who's willing to learn, who I always think has hobbies outside of physio is a good thing. But for us, at least an interest in or has participated in strength and conditioning work. Were you a PT? Have you done, S&C courses? Have you trained your whole life?
Is it a non-negotiable for you that they've done an Australian Strength and Conditioning Association S&C course?
No, I think that course is average too. So
I agree, it's average, but at the same time, I think it's at least something.
100%. Look, it's not so when Chantel started with us, she hadn't done that course. She went and did it. So, she was planning to do that. But she had a background in strength and conditioning training because she was interested in it from the age of 15.
Yeah.
So, that there overwrites any course that she's done because she's been actively participating in it. Now, look, you and I, right? We didn't do our ASCA to how many years in? 6,
yeah,
7
geez,
years.
I don't exactly remember when I pulled the trigger year-wise, but yeah, as you said, I remember even, in uni, I remember going to the gym with you up at Lavington or somewhere like that once. And I remember doing a session and it was just like, even then, without necessarily knowing everything there is to know about S&C and all the fundamental principles of how, hypertrophy works and all this sort of stuff, we still knew how to train because we knew what it felt like.
Yes.
You'd done the time, you'd done the different exercises, you'd seen the changes in your body and also the changes in your mates' bodies when they have done certain things in the gym. And that is so valuable.
And you can't replace that, and that's what you want to be looking for. Is it's, one example, this is a prime example, is probably the worst example I have. Said to this kid, look, you did your grad year. That's good. That's why I've called you in for an interview. And he goes, yeah. I said, look, you didn't get the job, but towards the end of the year, if I haven't found anyone, would you be interested? He goes, yeah, I would. Yeah, I would. I would love that. So I said, all right, I've got some sports work for you. Oh, I'm not interested. I said, oh, well, mate, I can't help you.
Why not?
Because he didn't want to do sports, yet he's coming into a sports and maths clinic because he didn't think the two were related.
Well, I think this is a good point. I think a lot of physios are coming out thinking that they don't have to cover sport on a weekend.
Yeah.
They can just go into clinic. And I've actually recently gone back into doing some weekend work. I'm the head physio of the AFL program at Riverview, actually, my old school.
Yeah.
So
Nice.
I've gone into that, and I'm doing a couple of arvos a week at the school, combined with a game or two on the weekend. And I'm kind of loving it. Like, I haven't done that sort of face-to-face sports-based coverage for a while, purely because I've been so focused on building the clinic up and my business. But it's kind of awesome. Like, I'm back into it. I'm a bit of a mentor as well and a coach as well.
Yeah.
Like, I'm like kicking coach. I'm doing a bit of assistant stuff as well. So I think young physios need to understand that sometimes you've got to do shit you don't want to do. You're going to have to work some weekends, and you just got to deal with it.
Yeah, it's part of the rite of passage. We all did it.
Yeah.
Like I remember I did my grad year and I was working with this private practice and doing this work on Saturday and Sunday. And I didn't get paid for some of it, and that's fine. I chose to do that. I don't necessarily agree with doing volunteer work, but I was still trying to get my way into that sports world. And mate, that's just part of what you do if you want to get the hours under your belt of experience. That's the only way to do it. So when he said to me then that he didn't want to do it, I was like, well, you know what? I'm going to pull it here. You are just don't even bother.
Yeah.
Coming back in Jan, because one of the girls who I regret this, but I don't regret it. I wanted to employ her at the start of the year, and I said, look, go off and do your intern year, thinking I'll find another physio as good as her. She did her intern year. I regret sending her off because she would have been perfect, but she comes into the clinic every Saturday and just does patients here, and it's paid work, but it's not exactly. She's on her weekend coming in here to do weekend work, but she wants to keep up her private practice skills while she's doing aged care rehab at the hospital.
Yeah, and that's great. And you kind of need to. It's much like the old adage of, if you don't use it, you lose it. If you're not doing some private practice stuff regularly throughout the week, maybe you need to be doing something on the weekend just so you keep up to date a little bit. I think that's pretty important.
And then for any employer, that's a positive, right? Like you look at that as a positive. You're like, there's initiative. She's got her skills up, and you go bang. You're someone I want.
And also that game day stuff is really beneficial when you get into clinic work, dealing with really acute injuries. So say, for instance, an acute shoulder dislocation or an ACL or something like that, and it gives you so much confidence and experience when you do go into clinic. Imagine you get an ACL and you diagnose the ACL on the ground before they're even off the ground, and then when you get that ACL client coming in saying that they, changed direction, they heard a pop, it swelled, it was really painful for 60 seconds. And then after that, it wasn't too bad. And then you do a Lockman's on them on the Tuesday after they've done it on the Saturday. And you're like, fuck yeah, I've already done this before. I did on the ground 2 months ago. Yeah. So yeah, I completely agree. I think it's really, really underrated. And it's also, you're in the deep end. You're by yourself.
Well, I did it. I covered one game last year for a schoolboy one that our clinic covers. I got nervous covering first rugby. I hadn't done it in 5 years. Actually, a colleague of ours, Lucy, does my weekend work.
Yeah.
So we went through uni with her. So she does my weekend work. One weekend she couldn't do it. So I had to cover. I hadn't run out on a football field for 5 years. I was like, mate, where do I run? Like, when do I go on? What do I do again? I had to, it was fine. Once you get into it, you're good. But it's that nervous anxiety leading up to the game, almost like you're part of it.
Yeah.
The players are going through their own thing, but you internally are going through your own battle, like of am I up to this today? You've got your own little thing happening.
It's also been really good getting back into it because, I had to retire from footy so young, when I was 19, 20, that I missed out on so many years around a football club. And it's good to be around some young kids again. And I was injured a lot around that age, sort of 16, 17, 18. So it's been really good to get back around that age group to try and help them stay in the park as often as possible and not get injured as much and all this sort of stuff. So it's been really beneficial, mate, and I'm thoroughly enjoying it. But I think the summary of it all for the new grads and also the physio students, you just got to put yourself out there, and sometimes you've got to do some shit jobs. You got to take jobs that you don't want to do, and you've also got to send a lot of emails, make a lot of calls to try and get jobs, because the job's not going to come and just grab you. People aren't going to ask you if you want to work at a clinic. I think Wayne Gretzky's great quote, you miss 100% of the shots you don't take. I love that quote. I think that's so imperative. You just got to throw yourself out there.
100%, and it's funny because a lot of the people I've interviewed, I haven't, my senior physio does all the interviewing. He just puts them in the category of, like, I was like, oh, what's wrong with them? He just goes, aged care physio. I don't know if that's a problem. We'll probably get onto this topic later. Is it a problem with our unis? Is it a problem with the people coming through? But he's saying, like, mate, they won't handle private practice. They won't be able to do it. And that's a really sad thing for our industry.
How long do you think someone can get away with doing aged care for without any private practice before it's too far gone?
I don't think it's ever too far gone.
Good point.
I think there are always ways back in. I think that if you want to learn something, again, you can do it. And again, it's like what we spoke to. Say you and I quit private practice today. We've had a gutful. We go off and do equine or aged care physio.
Equine? You can do that. I'm not doing that. I fucking hate horses.
Mate, they're just the athletes of the animal world.
Oh, he's getting a call.
I don't know why that happened.
Live action.
Mate, it is.
By the way, we aren't doing this in studio, everyone. We're doing this via Zoom because we're so busy that we can't really fit in going into a studio anymore.
It's also better doing it via Zoom anyway.
It's it's great. I've just come home for lunch quickly because I literally work 6 minutes walk from where I live. So I'll come home to do the podcast and I'll head back.
How good's that? But what was that? Let's say we go into aged care and equine, right? The thoroughbreds of the athlete world.
Yeah.
Well, other way around. Mate, if you want to get back in, it'd be the same thing. Like, say by then, 40 years of age, we go to a private practice, say, look, mate, can I do some mentoring? I guarantee you would have someone who would be, can I be mentored or can I do some shadowing? I guarantee you'll find a private practice out there who'll say, yeah, mate, come on in. After a couple of months, you'll be ready, raring to go. You would have done all your reading again, all your research, and you'd be right. So I don't think it ever goes. It's just, I don't know, maybe a lot of kids are intimidated by private practice. Maybe there's the fear. Maybe it's the whole KPIs type business thing that scares a lot off, because let's be honest, a lot of private practices have a pretty shit way of treating their clients. So, I don't know why the right candidates aren't always coming into private practice.
Yeah, for sure. And I think with private practice going forwards, there needs to be more of a shift into the S&C world. Have you seen a lot of private practices shifting their sort of mold and starting to integrate more gym-based equipment into their practice?
Around here, no. I mean, I'll probably say the opposite.
Yeah.
We've had a run of ACLs come in, and this actually makes us sad in the clinic, and it's sort of becoming all too common, where we're getting referrals from a surgeon after they've seen another physio for 3 months, saying, can you take over the rehab? I mean, how shit's that?
Yeah.
And we've then spoken to the patient, and one kid, he was a dancer, an actor. So, they're pretty demanding. That's pretty demanding, right? Dancing. It's not quite high velocity like rugby or AFL in the landing or the mechanics, but ACL injury doing dancing. He was discharged by his physio at 3 months and said, just go and run. No strength testing, no running assessment to even start to say, go for a running program. No running program. He had absolutely nothing. And then when the physio was looking after him, delved into what exercises he's doing, the first thing he said was band resisted hamstring curls.
What with the TheraBand?
The TheraBand. Discharging someone at 3 months saying, go and do a running program or go and start running, you're all good. You haven't seen any of it. You don't even know. You didn't even do strength testing to even find out. And okay, we've got resources here like, force plates and weights, much like you. But he didn't even do single leg testing. There was no hop testing, nothing that could be done in any clinic. And this story, I'm telling you, has happened at least 10 times in the past couple of months.
Yeah, it's not good. And people miss the point with the ACL and any rehab, really. Like, testing is such a valuable tool, and I use it all the time. And it's not bullshit testing, it's proper strength testing. So like with an ACL, I'll test people at 2 months, at 3 months, 6 and 9, and then I'll repeat the 6 and 9 month tests if they need to. But actually, speaking of, I had our old physio colleague back at uni and also a hybrid therapist podcast guest, Ellie Brush, in for the last few weeks.
Right, yeah.
She did her ACL back probably, it'll be 8 weeks this weekend ago. So it was a contact injury actually, because as we know, most ACL injuries are non-contact. She just got cleaned up from the outside of her knee and went into a valgus.
Or AFL now?
Well, soccer. So she was playing, she was playing a game, and then someone landed on the outside of her knee, and it was a valgus position. And anyway, so she had the surgery done by Musgrove, and she's going really well. But we did the 2-month test last week, and because she's an elite athlete and she's been an elite athlete for 15 years, mate, the testing was just ridiculous. Like, she's a freak. Like, she was getting numbers that I see that most people can't even get at like 6 to 9 months. You know, her numbers at 2 months were just insane. So, yeah, strength testing is very important. But I think the strength testing needs to be relevant to that client as well, because Brushy's a really good example. Like, if you look at the research with the ACL testing and even the Melbourne Rehabilitation Guide for ACLs, like some of the baseline measures for each testing sort of protocol for like 2, 3, 6 and 9 months is way too low, in my opinion, in terms of how many reps people should be doing, especially if they're an elite athlete. Like the testing for the discharge 9 months for post-op ACLs is like 22 single leg squats off a bench with your knee at 90 degrees. Brushy the other day did 60.
Yeah.
You know what I mean? Like,
She's probably going to go 30 kilos on a split squat.
Yeah, like I just think that like the testing stuff's important, don't get me wrong, but don't get sucked into just going by those protocols, because everyone's so different and there's some freaks out there. There's people that struggle. But yeah, she just blew my mind. I was just like, holy shit.
Yeah, well, you get those neuromuscular freaks, right? We talked about that in our row episode in season 1. But not only that, in season 1, we also talked about how protocols are not protocols and they should never be used as a protocol, but merely a guide.
Yeah, exactly.
You know, I don't know the last time I've used a protocol. I'll be honest with you. I haven't even looked at the Melbourne ACL protocol. I wouldn't bother with it. But
I think I will say one thing on that. I think the protocol, the Melbourne ACL guide, I've taken some bits out of the ACL guide to create my own 2, 3 and 9, 2, 3, 6 and 9 month testing. But I think the fundamentals of the testing would be a really good thing for most physios to have, and then you could put your own little spin on it.
Yeah, I agree with it. And I think that it's useful for your first, second, third, fourth year out. I think that's to have a protocol to use as a guide. And then by the time you start to get to where we've done 100 plus ACLs, and experience comes in, we sort of throw the protocol out the window because we know where to go with each thing based on their point in time. But that's an experience thing. That's time or hours in practice. So like I get the guys here when the newer grads, they still use a protocol as a guide. Yeah. But they certainly wouldn't rely on it.
Yeah. And it's important to use systems. I think that's another thing. Yeah. Like, rather than just guessing, that's the reason why I love the testing side of things with the 6 and the 9 month, because if someone fails something, it's pretty obvious. And then you get a chance to work on the things or the weaknesses that the athletes got, so they become competent, so they can return to the sport of their choosing. So the 9 month test is a really, really good one to use, because often I need to repeat that 2 or 3 times until the client actually passes it. And that's a pass to get back to training. It's not a pass to get back to games, which is really important. We've gotten off topic here as usual, which is actually really good. I like it because we wanted to chat about ACL stuff soon, and we want to get maybe Mick Hughes or Justin Rowe back on, or another surgeon. So that's something to come.
Yeah, I think given what we're seeing in the NRL, or in one club particular, it would be interesting to break that down and look at it. Is it the training? Is it the S&C? Is it the grounds? Is it bad luck? Is it shit luck that one team's had 4 ACLs in 8 rounds, or is there something else going on underneath that? I'd love to know.
What team's that?
Sydney Roosters, mate.
They're having a shocker, but oh, you got one on the wall. Lovely.
Mate, this clinic's full of them. There's three Chooks jerseys in this one.
Nice. I'll have to get one off you. I put a few Aussie Rules Guernseys up in my clinic the other day.
I'll swap it for. I've got a Swannies one here. I'll swap a Chooks
Do
one
you?
for. Yeah, I got a Swannies one in the front.
Oof, we might have to do a swap. I wouldn't mind a Swannies one.
2011.
Oh, nice. 2011, year before they won the premiership.
Yeah, I think they came 15th that year.
Yeah, they came out of nowhere, I'm pretty sure, in 2012 and won the flag.
Yeah, so that's why I've got that there. Is it's all about the bottom going from the bottom to the top.
Yeah, right. Now, mate, I reckon we've been going for about half an hour. I don't even know, but it's been great to chat again. Is there anything else you wanted to discuss?
Mate, I don't think so. I think what we touched on today was pretty good, right? To just give everyone a little update, what we've been doing, why we've not been around. And then, without going into it, sort of set up, there will be a couple more episodes coming here and there. It won't be as regular as what we were before.
No, I don't think, we're not going to probably do weekly episodes. We were thinking maybe one every 2, 3, 4, 5 weeks, something like that. It just depends on where we're both at. But I would say expect one every month, I would say.
Yeah, I think that's pretty fair. And I think, well, given where you are with your business, it's, you're at the point where everything ramps up, right? You've got a new space, regardless if you've been around for a while, having a new space puts new pressures on. It's going to be busy.
Yeah, for sure. And, due to COVID as well, all the online stuff's gone off as well. So everything's going well there. So I've got that online part of it, but yeah, exactly right. The new clinic's going well. And, in an ideal world, very soon I'd be employing someone, or it might take me 6 months to find someone. He'd start looking.
Well, because we've got our Randwick clinic, which is, staffed full time. And we're already looking for a staff member now, knowing that at the moment it's not quite ready for a staff member, but given how long it's take us to find someone of quality, even at Double Bay, which is, now up to 5 physios. We want to start that process now so that we're hiring towards the back end of the year. Yeah. So certainly something that, and particularly if you're picky, like I'm picky.
Oh, so, yeah. I'm an absolute perfectionist, so I'll be very picky. Yeah. So yeah, it's a good point. Maybe I need to start doing that because, it's something I do want to, pull the trigger on soon. So maybe it's time that a few of you younger listeners out there, or even older listeners.
How about that, Wildy? There's a spot. Email Wildy, email me. I'm not on Instagram anymore. I'm off at 100%. So don't hit me up on Instagram.
Yeah, don't hit me up in Insta either. Just find my email and email me your CV.
Yeah. Oh, we hate it. We spoke about that, but I went cold. The only thing I've got left is LinkedIn, and I want to pull the trigger and remove that.
Yeah, I think people place way too much emphasis on social media. I think it's a good free marketing tool, but yes. I'm pretty sure your Instagram now is being run by one of the staff members. Is that right?
Yeah, everything's run by staff.
Yeah, that's great. That's great.
That's obviously we spoke about Instagram before and the importance of it being a window into our businesses or our shop front, our online presence. We even went to TikTok. Yeah, we got a TikTok.
Did you?
I've never actually clicked onto it. I got no idea about it. But, again, it's just another window, another shop front that goes along with everything that you do in advertising. Do you want to be Insta famous? Look, I think not. Like, fuck that off. But, I think having those things for a business point of view is very useful.
Yeah, agreed. Now, That is episode 1 of whatever season this is. Is it, what is it, 4?
Season 4?
Yeah,
Fuck.
season 4.
Oh, geez.
We'll go with that.
Yeah.
Where can we find you, mate? Obviously, you're not on Instagram anymore, but what is your business Instagram that's run by the other fellas?
It's bfit.physio.
What's your website?
And bfittrainingphysio.com. And look, on there is, if anyone is looking for a job, I'm going to throw it out there, a bit of advertising. Do hit us up. Attention to Tom, because I don't look at any of that stuff. And you, Wildy, where are you at?
I'm at Wild Physio Fitness on all socials, and wildphysiofitness.com.au is my website. Yep. And look, if you're a young, keen physio and you would like to drop me a line as well, I will be looking soon. So I'm really happy with my space. So if you're keen to work in a really progressive, modern strength conditioning / physio setup, hit me up.
And then you might have to start taking some students from UTS. They're always looking.
Oh, yeah. Look, a couple actually reached out to me recently. I don't have the time. I don't want to do it. I don't really want to do that yet. But going forward, I really love the mentoring side of things. So, down the line, maybe at some point you and I'll be doing a bit of mentoring together at UTS or one of the other unis maybe.
Actually, which on that is the strength and conditioning course of physios at UTS comes out this
year.
Oh,
nice.
Yeah, which is, I forgot to mention that one. The things that we did over COVID, we got to put in some big man hours into that course. And now it's just being peer reviewed by all the academics, and then it's going to come out this year.
Beautiful.
So I think that'll be a good step forward for the industry, because it just gets rid of all the bullshit. It's not a certificate, so to speak, like what we're talking about ASCOs. You just do it for the paperwork. This is more of a hands-on intensive course that did, funnily enough, shift to online, obviously, during COVID. So we wrote it for online learning. But, hopefully Sydney at the moment had a little scare. Come out of that and we'll be back face to face.
Yeah, it's a good move, and hopefully the other universities around Australia take similar initiatives going forward.
Yeah, I hope so.
Well, this podcast is live on Apple Podcasts, Spotify, and Google Podcasts. I'll have to get the Hybrid Therapist account back up and running. It's still running, but I haven't done anything with it for ages.
I'll get one of the guys here to start posting.
Yeah, seriously, we need to. We are back on Instagram, but don't expect a lot of intel. We'll just post the episodes and do a bit here and there. But as usual, anything else to say, Andrew, before we finish up?
Stay hybrid, guys.
Yeah, let's finish with that.